There is a cost to be born and there is a cost to die. And without having insurance, both events can leave you and your family in a financial ruin. And so in this video, we're going to talk about why having health and life insurance is a must for the African American community and steps you can take in order to secure your family's health and financial future. Okay, and so if you are new to me, to the channel, or to any of my content in social media land, my name is Katrice and I am a licensed health and life insurance broker, and I am also the principal agent of the K. Daniels Insurance Agency, where the mission is to close the insurance coverage gap for African Americans. Now, here on this channel, I teach African Americans how to use health insurance to reduce their healthcare costs, their out-of-pocket healthcare costs, and how to use life insurance to leave a peace of mind and wealth to their families. Okay, all right, and so let's jump into it. Okay, health and life insurance. Okay, it is a must. It is a complete must for the African American community because insurance is an investment tool. First of all, okay. Let's take, for example, health insurance. Okay, let's talk about the importance of health insurance. Okay, so health insurance helps to cover your medical expenses. Okay, which makes health care more affordable. Okay, now this includes things like routine checkups, emergency room visits, surgeries, prescription medications, anything that has to do with your health. Okay, now without health insurance, these costs can rack up really super quickly. Okay, which is one of the reasons why a lot of African Americans have their credit, when it comes to their credit. Now, I know this no longer applies, which is a good thing. However, medical bills used to be one of the most damaging things for African Americans on their credit, and it made their credit scores lower because they were able to go to the emergency room to get the acute care that they needed, did not have insurance to pay for the care, and so it was sent to collections. They were billed, it wasn't paid, it was sent to collections. Okay, now I'm not saying that other races don't do this, but I'm specifically talking to black people because that's what this channel is. That's who I talk to on this channel. Okay, so and I've seen this time and time again with family members. Okay, also other people that I knew, that I grew up with, who didn't have insurance, and but they always said, oh, my credit's so bad because I got all these medical bills. My credit's so bad because I have all these medical bills where I went to the ER and they sent the bill to collections. Okay, so one reason for having health insurance, as you can see, is that it directly affects your credit. Okay, and in America, credit is king. And so without having a good credit score, there's a lot of opportunities that you may not be able to partake in because you have a bad credit score. Okay, so that's one thing. Even though they no longer look at medical bills like that. Still, you don't want to have medical bills on your credit. You want to be able to afford to pay for your medical care. Okay, and so that's the first thing, right? Is affordability. Okay, that's the very first reason for the importance of it. Now, the next thing is to use for preventative care. Okay, so the reason that your credit is bad, if it's because of medical bills, it's because you can't afford to go to the primary care doctor on a regular basis, okay? Especially if you have, say you have like high blood pressure or diabetes, not insulin dependent, okay? So meaning that you only take, you might take metformin or what's the other one? Metformin is the one I know off the top of my head, but you might only take metformin to manage your diabetes, okay? You don't need insulin, but you don't have a doctor that you can regularly go to in order to prescribe you your metformin on a monthly basis, and so then something happens, you have an acute episode because you haven't been taking your preventative medicines, and so you have to go to the ER. And when you go to the ER, they're going to treat the acute illness and get it down to where it's under control. But then it's up to you to go to the primary care to keep it under control. But because you don't have insurance, you can't go to the primary care, and so it's just a cycle, which is getting you more medical bills that you can't afford, that is going to collections, okay? And so that to be able to have access to preventative care is the second importance of having health insurance, okay? And then the third is financial protection, okay? Now, you may be saying, well, I could just get Medicaid. Okay, if you are in a state where access to Medicaid has been expanded, then you can get Medicare, okay? But that Medicare may not be sufficient. You may have it, but you're still underinsured because you may not have access to providers who take the Medicaid. It's a whole lot into that. I am going to do a video on that where I am talking about having access to care, even if you do have insurance, because that means you are underinsured, okay? But that's another video. But anyway, so you may just say, well, yeah, I have Medicaid, and if you are in a state where Medicaid has been expanded, then yes, you can get Medicaid, and then you'll have insurance, okay? But if you do not live in a state where Medicaid has been expanded, so like Florida, okay, Medicaid has not been expanded in Florida, and so I think after 19, if you have Medicaid up to 19, then they cut you off. If you have children, your children may be able to get Medicaid. You may not. You may only be able to get the share of cost Medicaid, which means that you have to rack up so much in medical bills for the month before Medicaid will kick in and pay anything, and that resets every month, okay? The amount doesn't reset, but it starts over, like the clock starts over. So if you meet that amount for the month of June, in July it starts back over, and you have to meet it again in order to actually have Medicaid pay for your expenses, okay? But the third importance of health insurance is health insurance reduces the financial burden of unexpected medical emergencies, okay? A beautiful example of this is not last week, but the week before last. So the last week in May, I actually had to go to the hospital. I went to the hospital on that Monday, on Memorial Day, because I just wasn't feeling well, and I had high blood pressure. I have high blood pressure, and I had been out of my medication. It's a long story that I won't really get into, but long story short, anyway, I had to go to the hospital, and I did not expect to be admitted into the hospital. I just thought I was going to go in. My blood pressure may have been elevated. They would have got me down, and then I could have made a appointment to see a primary care. Okay, I'm new to the area where I live now, and so I haven't found a doctor as of yet. So I was out of medication, and so I ended up having to stay in the hospital for 5 days. Now that was very unexpected. I did not expect to have to go to the hospital and be admitted and stay for 5 days. But I have health insurance, so I wasn't worried about the cost of of this unexpected medical emergency. I could just focus on me, getting myself well and coming home. I didn't have to worry about, oh my God, how I'm gonna pay this. I ain't got no insurance. It's gonna cost so much. I ain't got the money to pay for it. You know what I'm saying? I didn't have those thoughts, those worries, because I had health insurance. And so health insurance, you never know what can happen, right? You don't know what's going to happen. And so if that's the whole purpose behind insurance. Okay, insurance is to insure the what ifs. It's protection for the what ifs. Okay, and that would have been if I didn't have insurance, how am I gonna pay for this, right? That would have been the first question that came to mind. How am I be able to pay for this? And I gotta be in the hospital for 5 days, right? But having insurance, that was eliminated. Okay, so having health insurance, it reduces your out-of-pocket costs, and it helps you to prevent medical debt because it's less money that you have to pay. Okay, all right. And so now, so that's why you need health insurance, because if you're looking to leave any type of legacy or financial wealth or anything to your family, not having insurance, all you're leaving them is debt. Okay, and if you don't want to leave them debt, then you are definitely going to look into getting health insurance. Well, insurance period. Okay, health and life. Okay, so now let's talk about the role of life insurance in your financial planning. Okay, compared to white Americans, we don't financially plan. Okay, we collectively, okay, as a community, as African American community, we don't plan for the future. We plan for now. Okay, and that has a lot to do with systemic racism. Okay, we just call it a spade. It is what it is. However, we have to move past that barrier. Okay, we know what causes it, but we still have to move past the cause and come up with the solution, right? And so using life insurance to in financial planning is a way for you to take care of your loved ones after you have left. Okay, and you can also, it's an investment product. Life insurance, well, really all insurance, because you're investing in your health, you're investing in your life. When you get insurance, you're insuring your car. When you get your car, your home, your boat, you are insuring all that to make sure that if a what if happens, you're gonna be okay financially. Okay, and that's all insurance is to take care of the what ifs. I gotta keep reiterating that because I want you to understand exactly what the purpose of insurance is. And the purpose of insurance is to cover you in the event, is to financially cover you in the event of what if. Okay. Now, with life insurance, life insurance offers financial security to your loved ones in the event of your untimely or timely death, And so it ensures that your family's financial needs are met even when you are no longer here to provide for them. Okay? Now, life insurance helps to cover your funeral costs and any debts, and it also can provide some financial cushion for your family. Okay? And so, but it can also be used for while you are alive, depending upon the type of life insurance product that you invest in. Then you can actually use that insurance to provide you some type of a benefit while you are living as well. Now, this is not going to be something where you purchase the insurance, those types of insurance products today, and then next week you can go and start, using the living benefit portion of it. It does take some time to accumulate, okay? But as once it has grown and has matured and accumulated that portion of the product, that benefit of the product, then you can use it while you are alive. And depending on the product, it will not affect the death benefit. Okay. And so then now there's different types of insurance. Okay. There's term insurance, term life insurance. There's whole life insurance, final expense, which is a type of whole universal. The index universal lives. There's so many different types of insurance, and then there's also annuities, and so there's so many different insurance products that you can use. It just really depends upon your goals and what it is you're trying to accomplish, your financial situation. Okay, but what life insurance is really doing is preventing your loved ones from facing financial hardship or ruin during an already difficult time of your after your demise, right? Because you don't want your family to have to focus on how are we going to pay to for the funeral. And then they're already, got to deal with, I'm never going to see them again. They will never be here again. I will never get to touch them. I will never get to hug them. I will never get to tell them that I love them. Like, they're gone. And so now I have to cope. Your family has to cope with the fact that you're no longer here. And then on top of that, they got to worry about how they're going to pay for your funeral. That's cruel. That's so cruel. And so you have to think about it like, not having insurance. This is what keeps our community. I honestly deeply really feel like not having insurance and not putting it, doing any type of financial planning, estate planning, it really is a detriment to our community, right? Because insurance is a way to grow your net worth, to grow your finances, and a lot of barriers. Like I said, it is systemic barriers as to why we don't have it, but it's also a educational barrier of just really, I honestly believe that a lot of black people just don't understand insurance. They just don't understand it. And so when you don't understand it, you just stick your head in the sand and say, I'm not dealing with it. I'm just not dealing with it. I've had clients to tell me this, and I've, like even family members have said, I'm glad you do insurance because, honey, I don't understand it. Right? And I think those two things are kind of barriers, are reasons why, we have not, why we don't have life insurance, but it's also the push as to see, why we do need to invest in health and life insurance as a community. Okay. Now, I kind of touched on this a little earlier, but some disparities in having access to health care. Okay. Depending upon where you live, there may not be access to doctors that take your insurance, especially if you are in like a rural area. You may have to travel, quite a ways for health insurance, and so for health care. And so those are some things that, which is why we must really look into not just having health insurance, but we also have to look at it from the community standpoint of having access to care. Okay. Having more African American doctors and nurses that can work within our communities, having health centers that we can go to, especially for the elderly and the children, so that they will have places to go to have access to quality care doctors. Okay. Having health insurance can bridge that gap some and improve your health outcomes, because it does help you to be able to better manage your chronic conditions and get access to the necessary treatments. Okay. And so while there are some issues, and I think that the more that we as a community highlight these issues, and not just highlight the issues, because as a community we are great at highlighting issues. We will point out the issue in a minute, okay, but then no solution. Okay, we're not that great at being solution oriented, and so we know the issues and we talk about the issues, but in the same breath, it's time for us to start round tabling how it is that we can come up with solutions for these issues that are going on within our community, when it comes to access to health care, to paying for our health care, to getting the services that we need within our community. What are some ways that we can go about doing that, what we can do within our community without having to step outside of our community in order to get those services that we need? Because as you can see, other communities they're doing that. Okay, so it's not like it cannot be done. It's just we as a community have to figure out how we can work together to get these things done. Okay. All right. So another must why we need to focus on having health and life insurance is that life insurance is a way to protect your family's financial future. Okay, and it can ensure that your family's financial stability. Okay. In the video, I posted a video here on the channel where I was showing how you can use final expense insurance in order to leave something behind for your family. And so it's kind of an out of the box thinking, but I will I'll link the video here in the description of in the description of this one. I'll put it here, but you can check that out. And it's talking about how you can how final expense can be used in that way. Okay. But insurance, especially if you are the breadwinner in your family, or you have young children, you definitely want to start thinking about what is it, what am I going to do? How can I make sure that my child is protected when it comes to financially after my demise? Okay. The whole point of having insurance is that peace of mind for knowing that the what ifs are taken care of. You've already taken care of the what ifs just by purchasing insurance. Okay. And so that there is one of the main reasons, because it's time for us as a community, in my personal opinion, it is time for us to really step our game up when it comes to securing our families, okay, and really making sure that we are leaving our families, we are not leaving debt behind for our families, and we are showing future generations that this is the way that you are supposed to leave your family, okay, with wealth and not debt, okay. And so when you are looking at health insurance or life insurance, the first thing you want to do when you are looking to get covered is you are going to want to figure out what your needs are, okay. Exactly what are you needing when it comes to your health insurance, what your health needs are, how much you're wanting to spend for those health needs, and is it within a budget that you're going to be able, it's going to be something that you can comfortably commit yourself to paying every month, okay. And then same thing with life insurance. What are you looking to do? Okay, what are your goals? What are your financial goals for you and your family? How much are you willing to pay for those? Is it within your budget where you can comfortably pay that every month? You can commit to paying for that every month for the rest of your life, okay? Now, there are so many different plans and carriers and products out there that you can go through. You can do Google searches and start looking, at the different providers, depending upon what you're looking for. Now, it is going to be extensive, and you may not even understand what you're even looking at. You might be like, oh, what the hell is going on? Okay. And so if you are somebody who likes to do research yourself, you can go to my link tree and you're looking for health insurance. I have a free what to look for when looking for health insurance. You can grab that free guide, and it outlines exactly what it is that you should be paying attention to when you are looking for health insurance, okay. Now, if you're like, ooh, that's a whole lot, and I just want to work with somebody, I just need somebody to help me, okay, then you need to consult with a licensed health insurance agent within your state, okay, and they can help you to go through your needs, figure out exactly what it is you're trying to do, and then come up with the products that would best suit you, okay. Now, if you would like to book a consultation with me, if it's for life insurance and you live in the states of Florida, Georgia, Tennessee, or Texas, you can book an insurance consultation with me. Link will be in the description. And if you are wanting to look into some health insurance and you live in Florida, Georgia, Texas, Tennessee, Mississippi, or North Carolina, then you can book a health needs assessment with me. Link will be in the description, okay. And so I hope you found value in this video. I wanted to just highlight the importance of why we need insurance, okay. Because yes, when I talk about closing the coverage gap, Yes, it'll look good on paper as far as the statistics, that more African Americans are enrolled in insurance, but actually it's more so we as a people need to kill this cancer of debt and poverty that we have within our communities. We have gotten so accustomed to not having, or believing that we don't have, or that there's not enough to go around, and that is something that has really killed our community. One of the good things, though, I can say is that 2020 did show our community that just how important insurance is, health and life insurance. And so there has been an uptick in enrollment since then, which I am very proud of. I started insurance back in 2020, and the rise, especially of life insurance, within the African American community has been huge since then, but we still have a long ways to go. Okay, and so we have to as a community take care of us, and we have to make sure that we are doing the necessary work that we need to teach our future generations that we are a people of wealth, that we deserve wealth, and that we are not here to just live and die in poverty. Okay, so anyway, I'm gonna jump off my soapbox because I'll be on that all day. But anyway, my intention is that you found this video useful, helpful, or insightful, and if that is the case, please do share it out so that others may find that value as well. Also, give it a thumbs up. That does help the channel to grow, so if you could give it a thumbs up, that would be awesome. And I would love to hear your thoughts on this topic, so leave me a comment below. Do you have health and life insurance? And if you don't have health and life insurance, what is stopping you from purchasing? Okay, let me know in the comments. All right, and so I will see you on the next video, and remember that together we can close the coverage gap in insurance for African Americans. Have a good one.